Ina mana, ina reo, ina ro rangatira ma, tēnā te mihi ki a koutou, ko Lucy Day tōku ingoa. Tēnā koutou, tēnā koutou, tēnā koutou katoa. In case I run out of time, and I'm fully expecting to, I want to answer my own question first, which is two answers. They kind of already do fund spiritual health promotion, but they really could do a lot more. And if the Ministry of Health are here, we're very grateful for the money we've had in the last 10 years. 10 minutes is not long, so really I'm offering some ideas and quite a lot of questions in the hope that this is the beginning of a long and inclusive and productive conversation about what matters most. So the image is from the All Right campaign, which has been promoting population-wide mental health in Canterbury since 2013, since the earthquakes. And it's a mental health promotion campaign, but in fact, I would argue that it's really a spiritual health promotion campaign because it's inviting people to reflect on when they last felt awe or wonder is in fact a form of spiritual health promotion. So the All Right campaign has been quite successful in Canterbury. We have about 88% awareness across the city, certainly, and 47% of people who've seen the campaign can remember taking action as a direct result of seeing it. And so campaigns like All Right are very useful after earthquakes or terrorist attacks, but in a country which is trying to have well-being as our central policy-making framework, I think we can do a lot more to support communities and individuals to be more articulate about emotional and spiritual well-being. So good health promotion conversations start with the question, what matters to you? And bad health promotion conversations start with the question, what is the matter with you? And the very worst health promotion doesn't involve a conversation at all, as we diagnose from afar what the problem is. You eat too much, you drink too much, and you're too sedentary, you smoke too much. What matters to you is a health promotion conversation. And it enables communities and individuals to identify their priorities, much as our learned colleagues just before were talking about, the things that matter most within their context. And in our research, Māori told us what mattered most in a health promotion campaign for them was seeing themselves strong within their culture. And hence Te Waiorotanga, these set of posters and many other aspects of the campaign which celebrate cultural identity, in this case kapahaka. And similarly, our Pacific research told us that faith and culture and identity and family are central to health and well-being. So these are two of the most important documents from the current coalition government, the Inquiry into Mental Health and Addiction, which I'm sure Josiah will talk quite a lot about, and the new suicide prevention strategy, Every Life Matters. The first document does touch on spirituality, and Josiah will talk about that later, but interestingly, mostly places it in the Pacific pages of the report on my reading. And the second, if you word search it for spirituality, doesn't have the word in it at all. Although, interestingly, it does state that the vision is all people feeling that their lives matter, being able to see a positive future for themselves and lead fulfilling lives with purpose, balance and meaning for themselves. It's interesting that they don't call that spirituality. And of course, that may be a matter of semantics. So I'm going to talk about what I think these words, mental well-being and spirituality, are about. This is an amalgam of most of the literature that comes from positive psychology body of evidence, pulled together by my colleague Kieran Fox, just to show what the conversation about what mental well-being is. And then spirituality, from my perspective, is the practice of exploring identities and making meaning collectively. And then we've had lots of definitions from Richard earlier, and this important Indigenous mataranga that we now, as tangata tiriti, have access to. And for me, the most important word there is collectively, because our identities are shaped in relationship to each other and to things in the created world. And I say created, betraying my own cultural roots in the Judeo-Christian tradition. And as all religious traditions that I've had any experience of seem to offer some kind of framework for coping with and transforming human existence, so that while suffering may be inevitable, it can at least become meaningful. So we can't have these collective conversations which we're having here today without naming the multiple factors which have shaped our identities. So I'm here as a woman, as a queer woman, as a white English-born Methodist New Zealander, as a mother, as a health worker. And when I try to make sense of the world, these are some of the lenses that, among others, that I bring to it. And another key identity for me is as a one-eyed Cantabrian who has spent far too long thinking about earthquake recovery. And functioning well through disaster is a wellbeing challenge. And when we ran a competition with All Right for a compliment to the city, this is the one that won. So you can see it up above a very busy road bridge just before Christmas with our now gone stadium in the background. This is an example for me about collectively making meaning out of the aftermath of an earthquake. And this is, for me, spiritual health promotion facilitated through cash from the Ministry of Health. So in Aotearoa, we are very blessed with these concepts being conceptualised by Matua Mason-Jury. And the main lessons for Te Whare Tapawhā for me are that the domains of health are interconnected, the domains of health are interdependent, and we have different slides on this, but that the domains of health are rooted in the whenua, in the environment. So Te Whare Tapawhā is part of what the Ministry of Health has now taken on board. So we've got this reason to invest in spiritual well-being, but I would argue that at this time taha wairua is very neglected. And the best evidence on what supports people to flourish and to feel good. Another example of spiritual health promotion is the body of evidence about how creativity, both practicing it and witnessing it, can improve mental and physical health outcomes. So this is Otatahi Creative Spaces trust and evaluation of people, tangata whaiora, people with lived experience of mental illness, meeting together to create art and transform their lives and be well, because art transforms identity and meaning. And despite all the evidence globally and locally that this works, Arts on Prescription and similar projects to this are not funded by the Ministry of Health, and I think that's a real problem. And the Treasury Living Standards Framework really barely touches on spiritual or even cultural well-being. And so we have this opportunity collectively in Aotearoa to flesh this conversation out. Because currently our policies only fund certain walls of the whare, and that means that some people are without shelter. So the best evidence on the 5 ways to what promotes flourishing is the 5 ways to well-being, and these are universally accessible and grounded in rock-solid evidence. And you can see how the various schools of positive psychology map very closely to the 5 ways to well-being. So if we practice the 5 ways, these things, which are ingredients of flourishing, are what will happen for us to a greater or lesser extent. And to me, these 5 ways of well-being are deeply spiritual, and these 5 ways to well-being equally, this flourishing happens within Te Whare Tapawhā when we map the two together. So that's a very quick skate through, but I'm left with far more questions. And the questions that I want to have this conversation with you people and more about from here is, why is our conversation about mental health so trapped in the biomedical language and in deficit models? So we talk about people having mental health when we mean they've got mental distress. We've all got mental health. And why are we so afraid of secular discussions about spirituality? And why is so little public money invested in keeping communities strong rather than saving individuals who are in distress? So I want to end with this slide of the ruined PwC building in Otatahi, which has now been made the home of a very rare gull colony. This is an unexpected sign of hope and an unexpected consequence of the earthquakes, and something which promotes my spiritual well-being every time I cycle past from my office to the hospital. Spiritual health promotion is always happening. It happens despite us. But I'd love to be part of a continuing conversation about how we could support it better. No te roro, no nako te roro, kia ora ai te iwi. With your basket and with my basket, the people will be well. Nō reira, tēnā koutou katoa.
Now is it working? Yes. So 5 minutes of questions. I'll run up and down, then pass the mic to you.
Just teasing out your answer to your initial question, they do fund it, but not enough. I'd like to include the why in. Why don't they fund it enough? Because your original topic is why. Do you have more to say?
So they don't, in my opinion, although the inquiry report says that there is a great desire to keep people well and to invest in prevention and promotion, the amount of health dollars spent on prevention and promotion is pretty minor. And on kind of the broad canvas health promotion that I think works well, as opposed to the very detailed programs aimed at addressing a health deficit, very little investment. And we hear again and again from politicians that they don't believe the evidence that this kind of health promotion works. So why don't they? Because it's hard for politicians to invest in prevention when there's clearly still so much of a deficit to be filled. And also I think because they're afraid, as we've talked in already today, we are collectively slightly wary in Pākehā systems about the word spirituality. And so while we don't have an agreed meaning that doesn't look like giving money to proselytising, there will always be a reluctance from government agencies, I think.
Kia ora, Lynette Hudson. I'm the National Director for the Salvation Army's Addictions, Transitional Housing, Prison Reintegration and Hospice, actually. And you almost just answered the question I hadn't yet asked. But one of the things embedded in how we deliver the services that we deliver is the who we are as the Salvation Army. So it's the spirituality. And the battle is, from my perspective, it's about the proselytising. That's not what we're there for. We're there to try and help people understand the whole of themselves and not just a disconnected group of parts. A public health lens brings us forward from being in the crisis mode to taking a proactive stance on things, and spirituality needs to sit in there. So I think my question is how would you approach a public health approach in that kind of setting, saying we work in mental health and addiction and homelessness and prison reintegration. What would a public health stretching into that space look like?
Well, a lot of public health is about trying to modify the determinants of health, which are about poverty and housing, that kind of thing. But to talk about the proselytising risk, I think there are key narratives that underpin behaviour, and some narratives are acceptable and others not so much. And so if I think about the great narratives of faith traditions or cultural traditions, and we were just hearing about some of those, these actually shape who we are, and we're not articulate as a society about how we tell our stories. So that's kind of accepted at a policy level, that we need to teach New Zealand history, but there are more ancient stories. So the stories which sustain the Salvation Army's remarkable work are actually stories which create a framework in which that work can happen. But if you're not able to tell those stories, that is complex, isn't it? And actually, there's no battle for the stories. We can have multiple stories and lay them out before people so that they can find the stories which make their lives meaningful. I don't know if I answered your question, but that's a conversation. It is cruel to try and block this up into 10-minute conversations. I think this is just really a starter for 10, literally, for all of us.
Hello, my name's Colin Woodhouse and I'm a registered nurse at Christchurch Hospital.
Oh, hello.
Hello. My name's Colin, I'm a registered nurse at Christchurch Hospital. I am doing work on non-religious pastoral support for hospital patients. And I think what happened at the on March the 15th and the aftermath of that in Christchurch showed that people get their best spiritual support when they're talking to somebody that has the same worldview as them. And I know that the religious pastoral support people that we have in the hospital at the moment do a tremendous job, and they do support some of the people that are non-religious. But a huge proportion of non-religious people simply do not want to talk to the religious. And that is a huge barrier that we have at the moment. And I know that research work done in the UK showed that people who were non-religious, 7 out of 10 of them didn't want to talk to a religious person. But when non-religious people were available, they were 3 times more likely to actually take access to the pastoral support service. And that's something that we need to work on in this country, I believe.
I believe too that people are very open to having a conversation about what matters to them. So, all right is the question that starts a conversation about well-being, and the take-up of the campaign indicates to me that there is an appetite for that. So supporting a conversation that is based in well-being promotion, that's not a secular religious thing, that's about what matters.
I think what... Yeah? You sure? That's it. Go on. One last question.
Not a question, a comment, Lucy. Just that the Ministry of Health is misnamed. It's the Ministry of Illness. And why not look to maybe Ministry of Social Development or even the Treasury? Because if people feel better about themselves, the economy will be better.
Yes, I couldn't agree more. Let's talk.
Wonderful. Thank you, everybody.